Hi, I'm Dr. Elizabeth Comen. I'm a medical oncologist specializing in breast cancer at NYU Langone Health. And today we're going to be talking about breast cancer detection and treatment and all that's changed. For average risk women, we recommend that you start screening at age 40 with a mammogram. Now, how do you determine your risk? That's something that you can do with your doctor, and there's some online tools like the Breast Cancer Risk Assessment Tool. Ideally, as an oncologist, I would recommend yearly mammograms. One really important thing to ask when you get your mammogram is if you have dense breasts. If you have dense breasts, you may need additional imaging, such as with an ultrasound or an MRI. And if you have a greater than average risk of breast cancer, you may need to start screening before the age of 40. In general, we start thinking about imaging for breast cancer 10 years before the diagnosis of the mother having had breast cancer. There's a lot that's changed over recent years, including that we are often using what's called tomosynthesis or 3D mammograms, which are additional images as compared to the 2D mammograms that we historically did. Dense breasts are actually really common. Almost half of women over the age of 40 have dense breasts, and it's not something that you could see or you can feel. It's actually something that is determined based on a mammogram, and it has to do with the ratio of fat, which can look black on imaging, to breast tissue, which looks white. And what makes this confusing is a lot of times a breast cancer can also look white. So if you have a lot of breast tissue as compared to fat in your breast, trying to find a cancer can be complex. And that's why with dense breasts, we sometimes use additional imaging such as breast ultrasound or breast MRI to better detect a subtle cancer. A mammogram is the first step. And it's like an X-ray, where they flatten your breast and look at it with X-ray technology. Ultrasound does not use X-ray technology, but uses what's called ultrasound waves. So it is a different modality that can pick up different aspects of a cancer that you may not see on a mammogram. An MRI is a different type of technique, which uses magnetic resonance imaging, totally different than a mammogram or a breast ultrasound. And sometimes we use all three to detect a breast cancer. So in our culture, we often celebrate with alcohol, and that may be okay in some settings, but in many instances, we've normalized almost binge drinking, and up to 5% of cancers worldwide, including breast cancer, are attributed to alcohol consumption. Alcohol is a carcinogen. So I tell patients if they want no risk as associated with alcohol, don't drink at all. But in general, less than 3 glasses a week is considered a lighter amount of drinking and is less likely to be associated with an increased risk of breast cancer. Key important studies that have showed that in some instances for early stage breast cancers, we can actually de-escalate the type of treatment that we give, meaning less chemotherapy, more personalized therapy. And for those patients who are diagnosed with metastatic disease, the treatment landscape has entirely changed to be much more individual and much more specific to the type of cancer that a woman has. The other part, no matter what stage a woman has been diagnosed with, is that there is far more attention to lifestyle now, quality of life, the things that we can contribute to a patient's care to help them not only live with their diagnosis, but live better.
So should we normalize mocktails and mammograms?
I would say that a mocktail after a mammogram is your best option, but if you really want to have that glass of wine and you've allotted for it during the week, go for it.